I didn't always know that I was going to end up in senior services, but through my experience as a paramedic, I realized that there's a large population of aging people in our communities that are deserving of the very best care. And so I rode like I said, on the ambulance for a couple of years as a paramedic, and then got my CNA certification to be a nursing assistant and to work in nursing homes. And just through those experiences, again, I just realized that there's a large group of people out there that are deserving of the very best care, and that's our seniors in our communities. So, these are people that have helped build our communities, they're people that have helped raise our families, and they're just deserving of the very best care. And so through my kind of clinical experiences when I first started, that's ultimately what drew me to senior services, is getting to know those people, understanding them and hearing their history. It's just a really beautiful part of taking care of seniors. I always knew I wanted to be in healthcare because of my parents. They're both, a nurse and a doctor. But when my special draw to senior services was really because of my experiences. Getting to treat those people, hear their stories, understand that they got a lot going on in their lives, kind of at that twilight of their lives. And ultimately, they have multiple comorbidities typically and are needing of our healthcare services. So being able to fill that niche, if you will, and serve that population was something that was a special calling for me. Reedsburg Area Senior Life Center is a special place for many reasons. The services that we offer and the diverse services that we offer is one of the things that make us unique in our community and honestly in the surrounding communities as well. We have our adult day services, which is our only non-residential service, but that's a place where people can come for the day and enjoy our adult day services programming. Then we have our RCAC apartments, which is one lower level of assisted living. We then have our CBRF rooms, which is another level of assisted living, and then finally our skilled nursing facility. And because we have that full continuum of care, I think that makes us a very special place for people to call home. It allows people to age in the same location throughout their journey of aging, and it ultimately allows them to continue to know the faces, continue to know the people that are caring for them, and ultimately move through that continuum of care. It's a very special opportunity and something that makes the Reedsburg Area Senior Life Center unique. So Reedsburg Area Senior Life Center also has a very unique design in that it is very home-like. It's designed in a neighborhood concept, which means that there are different wings that people call home, and each wing has its own dining room, really kind of that more intimate setting for people to really get to know each other, to interact with their caregivers. That household setting really has multiple benefits from both a clinical standpoint. The caregivers are very, very close to the people that they're caring for, as well as the residents themselves. Again, they get that interaction with other residents, in very close proximity because of the household concept. So though it's typically not a person's choice to move into an institutional setting, what makes the Senior Life Center very special is that we really try to buck that trend or that perspective of being an institution and really make it as home-like as possible. Yeah, so Senior Life Center's Main Street is very special because it is modeled after downtown Reedsburg. So it really has that connection to the community. We have a bank, we have a post office, we have our Function Junction, which is our therapy services. But that real tie, that storefront look, really ties us to the community and makes us feel like, we're part of the Reedsburg community, which we are. And that's where these folks mostly are coming to us from. And so having that connection to the community is very special. One of the other things that makes the Senior Life Center so special is the culture that we have there, and it's that culture of caring. The frontline staff that are there every day, that's one of the beautiful things about senior services and aging services, is that we really get to know our patients. In other settings in healthcare, you may interact with a person for a couple minutes in a clinic or a couple of days in a hospital, but we really get to take care of our residents over the long term. We get to know them, we get to know their families. And so the people that are caring for those individuals, the seniors that we serve, they're very special as well, because they have to be able to, get to know these people and essentially become a part of their family, while also, being professional and taking care of them in a professional manner. So that's one of the very beautiful things about the Senior Life Center, is that we just have frontline staff members that are so caring, so kind. They believe in what they're doing and the good that we're bringing to our folks, honoring the traditions and the past that they have while also creating new memories. That's something that our staff really get at the Senior Life Center. So that culture of caring and that culture of compassion is something that certainly sets us apart. So yeah, the low turnover rate that we have at the Senior Life Center is absolutely one of our strengths. The staff that have been there for many years, they know our residents, they know our building, they know the connections here in the community, and that is a very special thing as well. I don't want to misquote the numbers for our state and national averages, but our turnover rate is well below all of those, and we're very, very proud of that because, again, that longevity speaks to the culture of caring that we have. It speaks to the purpose behind what we do at the Senior Life Center. So the most rewarding part for me as the Vice President of the Senior Life Center is kind of twofold. When it comes to patient focused, I would say the most rewarding part for me is just becoming a part of those people's stories. They've had long lives, as I've mentioned, they've raised families, built our communities, and these people are deserving of the best care. And so getting to experience that kind of twilight of their life with them is a very special honor. Seniors have so much to share with us of life lessons and hardships that they face, but also beautiful things as well, right? And so honoring that history with them is one of the most special parts of working in senior services. So I would say that's one of my favorite parts of being vice president there. The other one I would say is just working with an incredible group of professionals that are truly experts at what they do. But the thing that I'm most proud of is that every single one of the people that I work with, they are passionate about the people that we care for. They are passionate about doing the right thing for them. And that is such an honor and such a privilege to work with people like that every single day. It truly feels like we have a purpose in what we do, and we're serving the seniors of our community, which I think is one of the highest things highest purposes that a professional can have.